Hello. Welcome back to the Made to Mom podcast. I'm your host, Dr. Alexia Priolo, a naturopathic doctor. And on today's episode, I'll be discussing first trimester blood work and prenatal screening. So, when you go to the lab to confirm a pregnancy, you might be surprised at the number of vials of blood that was taken. I certainly was. I thought it was like beta HCG, maybe a complete blood count, but there were so many tests that they did. So, today I'm going to be discussing some of these routine first trimester tests, and some are variable and dependent on age, health history, and even diet. Now, blood work in the first trimester is incredibly important as it gives healthcare providers an opportunity to identify and address any potential issues early in pregnancy in the hopes that will lead to better outcomes for both mom and baby. Now, the first and obvious test there is beta HCG. So, if you listen to the first episode of the podcast, You're Pregnant, beta HCG is what is the pregnancy hormone. And this is what we test to go ahead and confirm a pregnancy. It can be detected in the blood as early as 11 days after conception. Now, a single beta HCG test will confirm pregnancy, but it can't really diagnose the viability of the pregnancy or where the pregnancy is. In that instance, multiple tests are needed as well as an ultrasound. Now, typically, people who are being seen by fertility clinic might have their beta HCG tested often just to ensure that the number is steadily doubling after an IUI or a transfer. In the case of like a low risk pregnancy, or someone who just got pregnant, usually beta HCG is only being tested once. The second thing that is typically done is blood group typing and antibody screening, done in the first trimester to establish the mom's blood type as well as her Rh factor. Now, the Rh factor is a protein on red blood cells that's either positive, so the protein is there, or negative, the protein is not there. So you'll know this as like the positive in O positive or the negative in A negative. Now, problems may arise during pregnancy with differences in the Rh factor between mom and baby. If a Rh negative woman is pregnant with an Rh positive fetus, her body might develop antibodies against the fetal blood, leading to fetal anemia or jaundice. When the blood of an Rh positive fetus gets into the bloodstream of an Rh negative woman, the mom's body will recognize that Rh positive blood is not hers, and her body will make anti Rh antibodies to cross the placenta and attack the blood cells of the fetus. This might lead to detrimental health outcomes, the most significant being death. Now, to prevent incompatibility issues, the Rh negative woman can receive Rh immunoglobulin, which is a medication that prevents antibody formation after situations like miscarriage or invasive procedures. Regular antibody screenings can determine if a woman has developed Rh antibodies, especially if there's a chance of carrying an Rh positive fetus. And so you'll probably see, at least I saw during when I was pregnant, that my blood type and Rh factor was tested at least twice. Once when I did kind of like that first screening of blood work, and then once I was accepted into the midwifery clinic, that hospital that I would be delivering at like wanted it on their own records. So the next is iron. So, well, let's we'll keep iron as like a bracket or overall title, but iron is the most common nutritional deficiency in women, with a high percentage of having iron deficiency anemia. Now, during pregnancy, iron deficiency is associated with increased maternal illness, antenatal and postnatal depression, and there is a higher risk of a C-section. In the developing baby, low iron levels are associated with low birth weight, prematurity, and intrauterine growth restriction. Now, to test a person's if the person has iron deficiency or an iron deficiency anemia, ferritin and a complete blood count should be tested. Now, one caveat is that during the first few weeks of pregnancy, ferritin might be artificially elevated because it's an acute phase reactant. So this means that its levels can rise in response to systemic inflammation. Now, pregnancy itself can cause some degree of inflammation in the body, which is why a complete blood count is routinely run just to give an idea of what the hemoglobin levels are and if a true like anemia exists. Now, ferritin is not just tested once during the pregnancy, it should also be tested in combination or alongside the gestational diabetes test, which is a test that we will talk about later on this season. The next up is hepatitis B. So, all pregnant people should be tested for the hepatitis B surface antigen during the initial prenatal visit, regardless of prior vaccination or tests. The people who are already diagnosed with chronic hepatitis B virus, this test confirms that their hepatitis B surface antigen status and ensures that appropriate preventative measures are taken for their infants. Pregnant people with hepatitis B virus infections pose significant risk to their newborns, and there's a 90% chance of them developing chronic hepatitis B virus. Undoubtedly, screening helps to reduce this risk through early testing and ensuring timely treatment and vaccinations in the hopes of preventing mother to child transmission of the virus. If the hepatitis B surface antigen test is negative, but there are ongoing risk factors for hepatitis B virus infections, testing will likely be repeated later on in pregnancy. Now, some of these factors include being born in an endemic country, illicit drug use, multiple sexual partners, multiple transfusions, immunosuppressions, having a hepatitis B virus positive partner, and being a healthcare worker. Rubella is another common first trimester test. If a pregnant person contacts rubella, it can lead to significant risks to their baby's health, especially if the infection happens within the first 12 weeks of pregnancy. Rubella is generally considered a mild illness, typically presenting with flu-like symptoms followed by a pink or light red rash. This rash usually begins on the face and then kind of spreads across the body, lasting around 3 days. Risks for the fetus include congenital rubella syndrome, which may lead to a number of serious birth defects such as heart problems, visual impairments, hearing loss, intellectual disabilities, low birth weight, and damage to the liver and spleen. Furthermore, miscarriage, stillbirth, and preterm birth are notable risks. HIV is also screened during the prenatal screening. And it's done as early as possible in the first trimester and then again in the third trimester. The reason is to ensure a timely diagnosis of HIV and quick therapy initiation, which may prevent transmission to baby. Gonorrhea and chlamydia are commonly are common sexually transmitted infections screened for in pregnancy as they can lead to serious complications, including preterm birth and low birth weight infants. Furthermore, some STIs can also be passed from mother to child during pregnancy and childbirth, which can lead to severe health issues. And the next test that is commonly done is a urine culture. So this isn't a blood test, but I've included it anyways, because it screens for and detects asymptomatic bacteria and urinary tract infections. Asymptomatic bacteriuria. Oh my gosh, this word is so difficult to pronounce. It happens, let's call it ASB. So ASB happens in 2 to 5% of pregnant women, and if it's left untreated, it can lead to symptomatic UTIs in 20 to 30% of the time, and then a kidney infection in up to 30% of the time. So those are kind of all like the routine tests that you'll get or have done during that like first round of blood work. But there are a few tests for people that I would highly consider advocating for. with their family doctor or just talking to their naturopathic doctor. So, all pregnant people should be verbally screened at their initial prenatal visit for a history of thyroid dysfunction, as well as current or past use of thyroid medications. Thyroid stimulating hormone, I'll use the term TSH going forward, should be tested to prevent complications because untreated thyroid disorders during pregnancy can lead to various complications, including early pregnancy loss, preterm birth, preeclampsia, placental abruption, anemia, postpartum hemorrhage, and congestive heart failure. Moreover, proper thyroid function is important for fetal growth and neurological development. TSH, at the very least, should be tested in the following circumstances: a history of hypothyroidism or hyperthyroidism or current symptoms or signs of thyroid dysfunction, known thyroid antibody positivity, or the presence of a goiter, a history of head or neck radiation or prior thyroid surgery, a person over 30 years old, a person who has type 1 diabetes or other autoimmune disorders, a history of pregnancy loss, preterm delivery or infertility, more than two prior pregnancies, a family history of autoimmune thyroid disease or thyroid dysfunction, morbid obesity, which is a BMI equal to or greater 40 kilos per meter squared, the use of lithium or recent administration of iodinated radiologic contrast, or a person residing in an area of known moderate to severe iodine insufficiency. Okay, so test TSH at the very least. At the very most, maybe doing an entire thyroid panel. Something else that should be considered is hemoglobin A1C. So, this refers to glycated hemoglobin, and it actually provides a snapshot of plasma glucose levels over an 8 to 12 week period. Screening is valuable in identifying women at a higher risk of pregnancy complications and in detecting pre existing diabetes. It's often used in conjunction with other screening methods to provide a comprehensive assessment of glucose metabolism during pregnancy. I want to note this. It is not a substitution for gestational diabetes screening. And we'll talk about this in a future pregnancy, in a future episode where I talk about gestational diabetes and what the screening entails and why it's important. But just because you had hemoglobin A1C tested sometime during pregnancy, it doesn't mean that you can go ahead and skip the gestational diabetes test. Vitamin B12 should also be screened for in pregnancy, as many people following vegetarian and vegan diets are typically low in vitamin B12. This is important because adequate B12 levels are necessary for proper fetal development, particularly with neural tube formation. On the flip side, I've had a lot of fertility clients come in, and I mentioned this in an earlier episode, where if someone's like seeing me in fertility, um, they might be seeing me for the first time and taking like a ton of supplements. And usually B12 is in a lot of things: a B complex, a prenatal, it can be in an iron supplement, it can be in an energy supplement. So we just really want to see like what are your vitamin B12 levels, and like, are they too much? Are they too high? And so this usually leads to a conversation in paring down some supplements for the time being. Vitamin D testing in pregnancy is also important and should be considered because low levels of vitamin D are associated with increases in preterm birth and preeclampsia. So, we'll talk about preeclampsia in an episode this season, but if I'm looking at a person who's meeting a couple of the risk factors for preeclampsia, I'm often advocating, like, let's just test your vitamin D level. They likely live in Canada. Like, I only see patients in Ontario. We only get the sun out for a certain time during the year, even though it's October while I'm filming. And, today's not sunny, but yesterday was a beautiful day. We want to just see where their vitamin D levels are at. And women with a vitamin D deficiency may also experience more body pain and insomnia during pregnancy. In the postpartum, low levels of vitamin D is also associated with an increased risk of postpartum depression. So, That's all the blood work that you have to look forward to once you get a positive pregnancy test. And so now I want to switch gears and talk about prenatal screening in the first trimester. Now, in Canada, prenatal screening is offered to all pregnant people as a non invasive way to assess the risk of certain chromosomal differences, including trisomy 13, 18, and 21. Now, through a combination of ultrasound and blood work, healthcare providers can help families understand the likelihood of these genetic conditions and shaping how they may prepare emotionally for the pregnancy and the postpartum period. Now, while screening provides valuable insights, it isn't diagnostic and it can't check for all non genetic health issues. Now, the first screen that you can expect during your pregnancy is the dating ultrasound, and this is done between 7 to 9 weeks of pregnancy. This is a transabdominal ultrasound that uses sound waves to confirm gestational age, estimate the due date, measure the crown rump length, assess the fetal cardiac activity, and detect multiples. Next up is a prenatal genetic screening, which assesses for chromosomal differences. Now, these screens can provide crucial information about a baby's health before birth to their expectant parents. For many families, knowing whether their baby has an increased chance of a chromosomal difference can be important for the emotional preparation and decision making of their pregnancy. Now, a positive screen result might prompt parents to consider additional testing and help them prepare for the possibility of a baby with special needs. On the other hand, some parents may choose to decline screening to avoid the anxiety of potential false positive or difficult decisions regarding continuing their pregnancy. Ultimately, though, the choice about whether to pursue screening is incredibly personal and can significantly impact how parents navigate their pregnancy journey. Now, as I mentioned earlier, the chromosomal differences that are screened for include trisomy 13, which is Patau syndrome. It's three copies of chromosome 13 instead of two. Trisomy 18, Edwards syndrome, which is three copies of chromosome 18 instead of two. And trisomy 21, known as Down syndrome, which is three copies of chromosome 21 instead of two. Now, the enhanced first trimester screen is done around 11 weeks and 2 days to 13 weeks and 3 days of pregnancy. This is performed via ultrasound and a blood test screening for trisomy 18 and 21. Now, the EFTS is exclusively available for pregnancies with one baby, and it cannot be done in a twin pregnancy or a vanishing twin or co twin demise. Now, a negative result means that your baby has a lower chance of having trisomy 18 or 21, but it doesn't mean that there isn't a chance of these conditions, though. It's just unlikely. A positive result means that there's a higher chance of your baby having trisomy 18 or 21. Most people with this result don't actually have a baby with one of those conditions, so further testing may be done to for more certainty. Now, along with the enhanced first trimester screen, like that blood sample, the nuchal translucency ultrasound is also done. It's part of this test, and it's done around 11 to 14 weeks of pregnancy. Now, the ultrasound measures a pocket of clear fluid at the back of the baby's neck called the nuchal translucency. Now, it's normal for every baby to have some fluid at the back of their neck during this time, but when there's more fluid than they would like, there is a higher risk of that baby or a higher chance of that baby to have a genetic condition or another health issue. This ultrasound can also provide an accurate due date and it can tell you how many babies you may be expecting. Or you are expecting. The ultrasound also takes a look at the baby's body parts like the heart and the brain. Now, in contrast, you have the EFTS, which has like the blood work and the nuchal translucency ultrasound. You can also do an NIPT if you choose. Now, this is a non-invasive prenatal testing and it's a blood test done after 9 to 10 weeks of pregnancy, and it screens for trisomy 13, 18, and 21. Now, during pregnancy, a baby's placenta releases something called cell free DNA. I'm going to refer to it as cfDNA into the bloodstream. The NIPT assesses the cfDNA, and depending on the amount of the fragments, a chromosomal difference might be suspected. If an NIPT test is done, there isn't any need for the blood work portion of the EFTS, but the 11 to 14-week ultrasound is still recommended. In Ontario, there are two options. You might qualify for this test, in which case, like OHIP, our provincial healthcare, will cover the cost of the NIPT, or you can pay for it out of pocket, or your insurance may cover it as well. So OHIP will cover the cost of the NIPT if the pregnant person will be 40 or older at the time of birth, if there's a past pregnancy with trisomy 13, 18, or 21, or if there's a current twin pregnancy. Like I said, if you don't meet the above criteria, but you're still interested in your test, in this particular test, your obstetrical care provider or your family doctor will arrange it for you, and it might be covered by insurance or you can pay out of pocket. The NIPT results are reported as either low risk or high risk. Now, similar to the EFTS, the results cannot definitely say if the baby has a chromosomal difference, but it is more accurate than the EFTS. A high risk result in a high risk population. So, this is a person where their maternal age is over the age of 35. They've had a positive EFTS. They've had some abnormalities on an ultrasound. Like the high risk is more likely to be a true result than a low risk population, than in a low risk population. Genetic counseling at this point might be recommended after you receive the result, as well as the possibility of further testing like chronic villus sampling or amniocentesis to know more, essentially. Sometimes the NIPT might fail and no results is given, and this might be due to some factors such as an early gestational age, a high body mass index, you might know this as BMI, in vitro fertilization, or multiple gestation pregnancy. Other options for testing include doing another NIPT, doing an EFTS or a second trimester screen, the 18 to 22-week anatomy scan, and or referral to genetic counseling where they may discuss diagnostic testing. Now, the diagnostic testing can be chorionic villus sampling or CVS, and this can also be done between 11 to 14 weeks. It consists of an ultrasound and invasive tissue sampling, and it does have the risk of a miscarriage. Now, CVS is a diagnostic test where a piece of tissue is taken from the placenta and sent to a lab for further testing. Now, the placental tissue usually contains the baby's genetic information. A CVS may be considered in the following situation: so, a positive EFTS screen, a high risk result from an NIPT, a failure of the NIPT after two or more times. The nuchal translucency ultrasound might have detected more fluid, or there may be a hereditary genetic condition. Okay, this episode had a lot of information, and so the blog posts will be listed in the show notes should you want to read a little bit more. But thank you so much for listening to this episode about first trimester blood work and prenatal screening. I hope you found it informative. If you did find this episode helpful, please subscribe to this podcast, leave a review, or follow me on social media. I'll talk to you next time. Take care.